Hey everyone, welcome to MedTech Innovator Live. I'm Paul Grand. I'm the CEO here at MedTech Innovator. For those of you who haven't been with us before, MedTech Innovator is an accelerator. We're focused on finding the world's leading innovators, the companies that are the change makers. We're going to transform healthcare, and we want to make sure that the best of those companies, the ones who make it into our accelerator and our showcase programs, are going to be as successful as possible. That's the whole goal here. And then we broaden it out with these YouTube live streams. We give anyone who's out there in the world the opportunity to learn the same curriculum. So we want you to have access to experts who can help you think in a way that's going to lead to success. That's what this is all about. You can find our webinars at medtechinnovator.org/live. And you can find the whole schedule and all the archives there. So today we're going to be talking about cybersecurity, device security. We're going to be looking at what some of the challenges are that innovators are facing that they need to be aware of. This is not something that everyone really thinks about, I think, enough. It's usually kind of reactive in many cases, and people are trying to put out fires after the fact instead of being super proactive. So we want to put you a little more of the proactive mindset today. We've got a great panel of experts that I'm going to introduce now, and we're going to have a conversation for an hour talking about this topic. If you are here on YouTube, you have the ability to put some questions in the little box over there on the side. We will monitor the chat, and I'll try and get it to our panelists during this first hour. If you're here from the MedTech Innovator cohort, of course, you're here on Zoom. You can queue up your questions in the Q&A, and then we'll get to those towards the end of the discussion. So with that introduction, let me go ahead and introduce our panelists. So we're going to start off first with ICS. We've got a couple of panelists who are experts. Let me start off with Shane Keating, who's the cybersecurity engineering and project manager. Tell us, Shane, a little bit about ICS and your role at the company.
Yeah, sure. So ICS as a company, we are very involved in the medical devices industry. We have a number of customers. We if you go to our website, you'll probably see quite a lot about user experience and helping medical devices companies actually come up with a user experience that's simple to use and interactive. We also provide services in terms of developing a whole platform. So everything to do with a medical device we can do, and that includes, implementing some of the cybersecurity. From my own point of view, I've worked in Intel previously on cryptographic accelerators, so I know a little bit about what's going on down at the bits and bytes level. We also have a function in kind of regulatory. So I'll let Milton talk about that a little bit.
Yeah, Milton, if you want to go ahead and unmute yourself, it's Milton Yarbury, who's Director of Medical Programs for ICS. Milton.
Hello. Yes. So as a Director of Medical Programs, I work with our technical program managers who do regulated projects within ICS. My perspective on cybersecurity comes from trying to apply the right trade-offs for each customer project. So I'm really coming at it from the client side in this regard, and in terms of trying to find their minimum viable product for cybersecurity within the context of their project. So and I come from everything from startups to lots of years at consulting companies. So I have sort of an accelerated view of seeing projects come and go.
Excellent. Very good. Great to have both of you here from ICS. You guys are experts in the space, and we're glad to have you. And let me add in Chris Gates. So Chris is Director of Product Security for Valentium. Tell us about yourself, Chris, and Valentium.
Oh, well, Valentium is a consultancy company for medical device developers. And we range from two-man startups to literally the largest medical device companies in the world. And we have a huge number of clients. And we offer services from firmware development, mobile app development. We even do regulatory. We also do user focus as well to UX, as well as even things like just test equipment for production line. So we cover all the different areas. And I have been creating medical equipment for 49 years, mostly class 3 medical devices. And then starting, I've always done cybersecurity, both helping whatever my employer was, but also going over and reverse engineering competitors' products, attacking their wares and looking at that. But this all kind of changed about 13 years ago when I happened to be at a company that got hacked, and they didn't know how to deal with this. And I started showing them how, why, and you have to say, yes, you're a hacker and present yourself that way, which is always an interesting discussion. But that went so well. And I happened to run into one of the founders of Valentium, who was also doing some contract work for this company. And so 5 years ago, I joined Valentium as the director of product security to build up not only our own products that we create for our clients, but also to work with our clients and help them with their products. And that can range from, I've just did a pre-market approval and I got slammed with a bunch of questions, to we want to do this right and we want to set up all the governance and all the policies and correctly address this. So it's been a fun ride so far, and I've kind of enjoyed it.
Well, I'm enjoying it already. We're just getting started. So glad to have you through here. Thank you guys for being with us. So Chris, I'm going to start with you, just kind of in general here to set some of the table for our discussion. I want to make sure everyone understands kind of the perspective I'd like us to be talking about today. Is we've got a bunch of innovators who are here, who are part of the MedTech Innovator Accelerator and our overall cohort, plus other people out there on YouTube, many of whom are in the same boat. And I want to get them the mindset of the people on the other side of the table. What's driving the decision makers, whether they're customers, regulatory agencies, consumers, even in some cases about data privacy. So I want to kind of get in their heads a little bit so that we can think as innovators as to how to be prepared for that. So that's probably our overall discussion today is going to be kind of framed that way. And I thought maybe a great way to start, Chris, is the presidential executive order that just happened not too long ago. And as a result, I know, that there's people out there who used to just be, thinking reactively going, oh, FDA said I have to patch these holes. And I've got some fires to put out now. People are now being more proactive. So give us kind of that mindset as to what's the mindset out there like now that this is out there, the presidential executive order, what does that mean? And what are people thinking?
Yeah, and that has been quite a sea change, because you're quite right. Most of my engagements were, I got back 24 questions, cybersecurity. I don't even know how to spell cybersecurity, let alone how to answer their questions or do what is going to be needed to answer those questions. That was 90% of everything. Well, like in the last month, I've onboarded 3 new clients who came to me and said, no, we want to do it right. We want to start at the top. We want you to help us do all the governance, figure out the roles that we're going to have to staff, how we do this, how we do continual improvement over the years to come. And it's like, great. Really do it right, not fix a problem, but just instill it as the culture in the company. And so the EO has done this. It's also brought about a lot of visibility to things that a lot of intentional blindness was going on in our industry. It's, bury your head in the sand. If I don't look at it, it's not a problem. Well, now you're going to have to address it. Things like the software bill of materials of your third-party software component that are being utilized in your medical device. Very, very cool stuff like that has been on the back burner of being defined by people like I'm on that working group for the definition of it. But it has been backburnered and hasn't really been applied. Well, now it's going to apply to all 16 of the critical infrastructure industries that's covered by that EO, including medical device. So very cool stuff. One of those, by the way, is cybersecurity labeling. And I love this topic for the simple reason it's a market differentiator. One of the problems has always been viewed as cybersecurity as nothing but a cost center. It's just a hole that you pour stuff into. You can't go out and brag about it. You don't go out and say, oh, look, my new ventilator is completely unhackable. Don't do that. Don't ever do that. And nobody does. But what you can do now is there are some artifacts that are coming around, like the software bill of materials, like the MDS squared, okay, and now the cybersecurity labeling that puts your product in a better light and will make more money with that product against your competitors if your consumers can look at that and make some very simple basis judgment calls on the risk they're taking by buying your product. So if I'm buying something that doesn't have a cybersecurity label on it, or has the lowest level of cybersecurity reference on the label, and I'm competing with people who have the highest tier on that cybersecurity level, they can now start to make judgments based upon that. So kind of very cool stuff going on. In the United States, it's in its infancy right now. Really, we're still trying to figure out what we're going to cover and exactly how we're going to do it. It appears at this moment that it will cover things such as what we did for this particular device, as far as testing and how well it went through it. What we do as a secure development lifecycle as a manufacturer, and privacy information about the data that's being collected and how the user can manipulate it. That appears to be the 3 tiers they're going to flesh out. For a really good read on this, Singapore has already enacted this, and they've got their own approach to it that is a 4-tier system, and you have 1 to 4 asterisks on this digitized or specially label that you can put on your product or in your advertising. So you can use this. So now you're going to have sales pushing for, I want a secure device. We don't want to go out in the market and look horrible. We can't compete with everybody if we're less than them. So this is a market differentiator. It's a way to make yourself look better through cybersecurity. So I love this. I think it's a great approach.
Thanks, Chris. Boy, you just covered a lot of stuff in that, and we're going to unpack a bunch of that as we go. So I'm going to go over to Shane and to Milton here for a moment now. So let's also, in addition to kind of the presidential executive order as a driver, I know also ransomware has been a big driver, and we can dig into all the S-bombs and all of this stuff in a moment, but let's start off here. Just setting the stage for everybody that in addition to, an executive order, that there's ransomware out there. I know these attacks are literally shutting down providers from delivering care for days, for weeks, or even longer in some cases. So what are some of the important things, just again, for people to think about in terms of what's going on out there and what early stage companies can consider in terms of reducing the liability that they're introducing with their products?
Yeah, exactly. So, all of you are engaged in making people's lives better, right? All of you are engaged in this kind of industry because you probably love technology, and you also feel that there's a chance here to really make a difference to people's lives. What has really made a difference to people's lives recently is that I'm from Ireland, and taking that as an example, our entire health system, our entire authority that governed health information was hacked there recently in spring. It meant that all of the hospitals in Ireland had to go back to pen and paper overnight. Radiology appointments, all sorts of different areas just were slowed down or cancelled for weeks. That really makes a difference to people's lives. It's important to think about, like, your medical device is vital in and of itself. It is obviously designed to make somebody's life better. So, you have a duty there to keep that up and running, to keep that going, to make sure that the private information on that device is not leaked either. But the other thing about this is that, what we see from these ransomware attacks is that attackers out there are constantly looking for the weakest point in a system to get in there and see if they can get credentials or some kind of way of accessing higher points in the system. So you may think your medical device is, well, if that gets compromised, what effect does that have? Well, your medical device may contain information on how to may contain credentials and how to log into other databases on the health network. And all of a sudden, your medical device could become an entry point. So it really is, important to think about this stuff at the start. So, like, what I would say, the best time to start thinking about this stuff is actually at the start of the device life cycle. But, failing that, maybe now is also a good time. But certainly the best time is when you start thinking about pen and paper. What kind of platform are you going to use here? What kind of microprocessor are you going to use? What kind of a interface to the user are you going to use? That can be really crucial to how well you can protect your device, and therefore how well you can protect the network from attack later on. So if your platform has the horsepower to deal with those encryption workloads at the start, that's a great start. And maybe, trying to think about that stuff early on is certainly better than trying to, as you get towards approval, think about how the hell am I going to satisfy all these things that the FDA want me to do.
I think that's a nice segue too for Milton. FDA, what do they want? I know there's guidance out there, so maybe Milton, you could share a little bit. I know Chris, you've been involved in working groups. We can get to that you too afterwards. But Milton, just maybe just a little bit. What does the FDA expect from an innovator now on their submission?
Yeah, well, I think of cybersecurity and how the FDA treats it is really just an extension of how they treat overall risk analysis. So they want you to have a process. They want you to execute that. They want you to define it on paper. They want you to execute that process. They want to see the evidence of it. I think emphasis, of course, on post-market activities now is much higher. I mean, going forward, I think on all fronts, we just generally expect, we expect technology to get better and we expect the constraints to get higher. So, and cybersecurity is really no different from that. One of the threats, sort of building on what Shane was saying, that I think of often is that the scenario with the consultant that appears on your doorstep. So even if your medical device doesn't have PHI on it, has limited attack surfaces. Even if if it doesn't have it's not a huge vulnerability to begin with. The mere fact that somebody could get into your system means that they would be able to broadcast that, and then that becomes, frankly, a bit of a blackmail situation. I mean, and I think the scenario that I heard outlined one time that always comes back to me is, the consultant that shows up on your door saying, "Hey, I can get into your system. Do you want me to show you how?" And it's I won't say it's a viable business in the future, but I mean, you can see that there's opportunity there, and where there's opportunity, people will go. So
I've always been amazed at those folks, by the way, Milton. I mean, they really think they're going to hire you? They don't. They come to people like us and say, "Hey, this guy's attacking us. What can we do about it?" Okay, we're not going to trust him. So he's great for our businesses, but he's not so great for his own business. So keep on attacking out there, folks. I think somebody's going to hire you. Yeah, very much so. There is a lot there. And I think what you can take away, I mean, the FDA did actually a huge disservice to our industry back in 2014 when they first released the pre-market content guidance for cybersecurity on a pre-market submission. Because it basically said your devices should be secure, we like puppies, unicorns are cute, those kind of things. And it's like no concrete, actionable things that needed to be done. And then, of course, in 2016, they kicked out the post-market guidance, which was a much more definitive document. These are the things we want you to do with a slight flavoring of "or else" in it. It wasn't that slight. It was actually pretty blatant threats. And then in 2018, they kicked out the new pre-market draft guidance, much better document, a much better document. It has all the content you want in it. The things that were bad is they stuck with the same format as the 2014 one. So the document was largely unreadable. And many of us, I mean, I filed some 30 some odd observations on that document. So that's being changed. And there's a new version that's supposed to come out before the end of the year. Same basic content, but reformatted, and the tiering system goes away because everybody hated that. It's just going to apply across the board. And that's one of the things that people don't get, by the way, is when they're new to this, is they go, "Well, mine is a low risk device." They don't care. They want to see you doing these activities. Okay. Or "We're a 2-person startup. We don't have to do that." Yeah, you do. Okay. They don't care whether, you're Boston or Edwards or Medtronic, or 2 people in their garage. This is what they're expecting. Also legacy. when you take your legacy, you've got a product that's there and you go, hey, I'm adding a new feature here and this one's now going to go to 11. But we never had to do security before. Oh, yes, you do. Now you do. And as Shane was saying, you may have made bad design decisions and created design vulnerabilities that you cannot patch your way out of. It may not be a coding issue. It may be a hardware issue. You used an MSP 430 level 2 or something that is, easily physically attacked and no real way to lock it. No crypto capabilities, no hardware acceleration to those. So those are the things why I totally agree with Shane. You got to get in early, look at those, and it'll save you so much time and energy down the line. And then you can celebrate those wins in your submission. So the FDA doesn't have to ask you a bunch of cybersecurity questions. It'll go faster and you'll have a much better engagement. But you have to know how to structure that and communicate that to the FDA so they can see that you did the right things.
Can I jump in there, Chris? Back to Paul's mention of SBOM. So many of the things that we recommend clients do, they're fairly tractable in this area, depending upon the attack surface, the use case, et cetera. SBOM and being responsible for this sometimes incredible stack of software and components that go into a device seems like one of the areas in this entire scheme that, it makes me a little woozy when I think about, the amount of effort that it would really take to, validate each tool, stay on top of each update and the threats to each. Can you comment a little bit about that?
Yeah, there's a lot of great tools. Well, first off, let's scope what is an SBOM, okay? It's a machine readable format in a markup language, either XML or JSON. There are three major standards. There's SWID, which don't use, and then there's Cyclone DX and SPDX, both of which are great formats. SPDX came out of the Linux Foundation. It's now an ISO recognized standard. Cyclone DX it came out of Steve Sparrett and is now an OWASP standard, and ongoing work is being done on it. Originally, all these SBOMs were created for license tracking. And, you don't want to use a GPL licensed product in your device, for instance. And some of them, like SPDX, mutated and became more about vulnerability tracking. And largely these mutations occurred because of the NTIA's work and the absolutely wonderful Alan Friedman, who's now at CISA, but he used to be at NTIA, great guy. He herds cats better than anybody I've ever seen. And he really good. So we pushed back on these existing standards and had subtle changes made to make this a more workable process. And these for the last 3.5 years, the working groups have been working on this of how to make these things valuable and how to make them so there's the tools that's there that's doing them. So both SWID never really came to the table, by the way. They didn't really make a whole lot of changes. That's why I don't reference that much for this, but SPDX and Cyclone DX both have great tutorials and more coming, have great open source, closed source tools that are out there for both the creator of the SBOM and the consumer of the SBOM. So this thing is new. It's here. You can do it. We've been doing it for months, for instance, for our clients. And I highly recommend you go that path. One of the cool things is this is not only giving your customers, the HDOs, visibility into your black box, because they're the ones in the front lines. They're the ones who, if they get ransomware and it comes in through your pole mount infusion pump, well, that's a shame. And boy, there might be a dip in our stock prices or a dip in our sales or something as a manufacturer, but they're down. Okay, they've been taken down. Some of the things you're starting to see now is contracts languages being rewritten to put liability on those folks. So if you create an insecure medical device, and that's the pivot point into their hospital, and that hospital loses $100 million for being down, guess who's on the liability hook for it now? So this is some of the stuff we're going to start to see here going forward. So a lot more of the lawyers are going to play into this as well too. So SBOMs are really cool because this gives these frontline people the chance to satisfy their risk appetite. They go, oh, look, they've got this known vulnerability has just been exposed in this automated system that can tell you every day. They can decide, do we contact them? How do we handle this? Do we unplug it? Do we feed this device into a computer? What do we do? Okay, so they can do this. It's a great approach. And in fact, the one following it is kind of even really better. SBOMs are pretty much static for a given bill. Let's not get into SaaS and all that. There's other things there. But the traditional medical device, you build it, you burn it into the device. It's pretty much static for the build in that version. But there is other things like I'm using OpenSSL, but I didn't even include the code. The binary isn't even there for Heartbleed, okay, with that memory leak that's in it because of how you compiled it. So how does a manufacturer convey that? Right now, we do things like websites where you go out there and you have a security announcement and you do this as security advisor. That's all free-form text. That's horrible. Or we email out our clients. That's even, now you've got this burden of, you're doing hundreds of these things a day. Okay. I know Tim Walsh at Mayo, they get buried in these things. Okay. And they can't keep up with it. So we realized early on that a software bill of materials was a great first step in supply chain, but it wasn't everything. What it needed was what we internally referred to as a VEX, for a vulnerability exploitation. But what we landed on was we didn't want to create a whole new format. So we partnered with Oasis Standards, and we are using their CSAF format, the Common Security Advisory format. Again, a JSON markup language that can be consumed automatically, and it gives the manufacturer's viewpoint. Is this affected? Is this not affected? Okay. And some other subtleties beyond that. But that's the first binary divide. You want to know, do I need to do something? Okay. And so this allows you to scan these things and know, okay, it also represents things like under investigation. So you know, okay, the manufacturer's aware of it, but they don't know yet. They're doing root cause analysis. So SBOM is really cool. It's the best tool we've got post-market, but it's not everything for supply chain. Supply chain has about 10 vulnerabilities in it, inherent in how it works. SBOM covers 2 or 3 of those, and that's about it. It's a great tool. Don't get me wrong. I've invested lots of hours into it.
Yeah.
But it's not everything. So there's a lot of things. I mean, I don't know if you saw the Sonotype report that came out yesterday or the day before. Last year, we saw a 650% increase in supply chain attacks. 650%. Okay. And they're poisoning the well. They're going out to open source packages and intentionally putting in vulnerabilities, backdoors, if you want to call it that, so it can be exploited as they're put into products. There's a lot to this. So supply chain is going to be a topic you're going to hear for a while, for the next few years, as we figure out ways to do this and secure it. SBOM is a good piece of that puzzle, but it's not everything.
All right. So that's, oh, sorry, Shane, you look like you were about to say something.
Yeah, no, I was just going to say, following on from that, like you'll hear a lot about vulnerabilities cropping up in software that's out there, open source software or whatever it is. A real problem that we have is it's very hard to predict what kind of new vulnerability is going to happen, what kind of new vulnerability is going to be found in the next few months, year, whatever. Just taking an example of a vulnerability, something that's got a lot of press recently is the Bad Alec collection of vulnerabilities in just how you allocate memory in your code. Now, looking at this, it's got a lot of publicity. It's up there on the FDA website. As a medical device manufacturer, you will have to do something about it. But nevertheless, like when you look at the actual details of the vulnerability, it's you have to get into somebody's device and execute some code in order to take advantage of this, or possibly in some kind of weird circumstances, you might be able to input a value in the user interface that creates a really infinite number of buffers. This is it's kind of a corner case. So when these vulnerabilities come up, yes, there will be a lot of publicity about them, and you will have to do something about them. And for that, you will need a software update mechanism. And that's one of the key things to think about when you're at the start of this process is embedded devices that are out there. Many of them may not even be connected to the internet for a start, but even the ones that are, they don't have a patch Tuesday. They don't have a regular sort of software update schedule. Oh yeah, there goes my medical device again. It's on its patch cycle. You don't see that, right? So managing that, thinking about that process up front of, if I've got a fleet of devices out there, and something goes wrong, so somebody finds a vulnerability in that SBOM, how am I going to update that? Can I rely on my user base to plug in a USB? Can I rely on my user base to say my device is going to be offline at 1 a.m. in the morning? Is that really going to happen? Those kind of decisions really need to be thought about up front.
And unfortunately, it's a whole different environment because, I mean, you have, like here in the States, there is one hospital where the guy who mows their lawn is the guy who sets up their IT infrastructure. Okay. And so you can't expect competence on that side. Okay. And that's actually not that uncommon. And then what is uncommon are the Mayos of the world, where they pen test everything that comes into their environment. So, I mean, they're the high end of the scale, but most of the institutions are at the low end. And they're very uneven. They may block you completely. If you have Ethernet capability out of this thing or Wi-Fi, they may block you completely from accessing it. That's a very, very common approach. So you don't have that capability. You're also using things like USB to update that. Oh, give me that. That's my attack vector right there. I'm going to go after that all day long. But even worse than that, as a manufacturer, if you've got a serious problem, the Department of Homeland Security is calling you every day, having little conversations like, how's the rollout going? And they're such a fun-loving group. They just don't get humor. If you said yesterday, I'm at 64%, today you better say 65 or greater. Well, that means if you're doing USB sticks and people are running out and doing it, you don't have that visibility. You don't have that pane of glass to tell you how the rollout's going. So besides being a great attack vector, I love it when they do that and put it on USB memory sticks. That's wonderful. Thank you. I'll just take that and attack it and reverse engineer it. But so a lot of problems.
Chris, do you mind, Chris, if I interrupt for 1 second there?
Sure.
So what is the best practice? I'm just curious if USB, sticks is the update mechanism is not. What is best practice?
Highly uneven is the answer to that. All the way from USB sticks. Whenever I run into a client that does that, I make certain we get rid of that. All the way up, some believe in sending the medical device back to the medical device manufacturer, believe it or not, and doing it that way. That's kind of a slow rollout, but hey, at least it works and you can track it and keep records of it. It really, really depends. And if you're a manufacturer and you're, gosh, I'm working this company, I almost said one of the names that I really like, but believe me, they don't do it securely. There is so few who do it right. I say this as an attacker systems. Okay, so let me talk about the ones who are doing it good and they're silicon manufacturers. Silicon Labs does a great job of it. Go look at theirs. That's a great example off of. ST Micro also has a very good approach, and by that what I mean is inherent in any software update, you have 3 inherent abilities. Explorer of your code, because if I get a hold of that code, I'm going to reverse it, decompile it, and I'm going to find other mistakes you made. And I'm not just attacking one, I'm attacking all of your devices in the field then, okay? All right. Integrity checks. As that firmware image goes by, can I tag on my own code into it and have that burned along with it? All right. And then rollback protection. So if I know that your version 3.6 has a problem and I give you a valid 3.6 image and you ingest it, but you're currently sitting at version 4 and I roll you back to 3.6, okay, and then I exploit that known vulnerability. So what's the protection? You encrypt your payload, you do integrity checks like an HMAC or a SHA-256 on it, all right? And then you just do a simple compare and say, current version can only go monotonically up, all right? And so those are the approaches that you use, but they're very difficult. I've actually thought about creating a tool and centralizing this for it, but there's such huge liability with it that I don't think it would be a good thing to do as a business. I'd be incurring too much risk. But and then some of the better institutions, they want to know these devices are being updated. So they want local awareness of this. Again, the guy who's mowing the lawn, he doesn't care. And probably all the folks.
But Mayo cares.
But Mayo cares. Mayo cares. And other big institutions, too.
Right. And just to clarify again, one more time, and then I want to go on to another topic here. Just again, like inherently, the question is like, why are USB sticks inherently bad? Like, what is the issue?
Well, you don't have that insight you need to report this to the regulatory agencies on a daily basis. I wasn't kidding about daily DHS calls. That is what you get, okay? And they have no sense of humor. And they want to know how that rollouts going because they're looking at it in terms of hours. So you don't have that visibility. If you send it out, you don't know what got updated. Okay. Oh, sure. Have a form. Great. You know how that's going to go. That's never going to back propagate. So there's that, but also having access to that a device that has your program on it is a great attack vector. I can attack that. And if you haven't done your due diligence to secure that payload, I'm going to reverse engineer it, get all your intellectual property, find all your security vulnerabilities, and I'm going to do this in minutes. And if you made that kind of mistakes, you made mistakes in your product code as well. So then I can start looking at attacking all of your products. And I can come to you and say, hey, great, I'm going to attack your products, or I'm going to short your stock and attack all your products. And that's how I'm going to monetize it.
And I know it. Oh, sorry, Shane. I was going to say, and I know from our, our previous discussions we've had with the FBI and with others on this topic, that USB sticks have always kind of been the biggest, the human weakness is we find that USB stick laying around and we go, oh, that's a free USB stick and let's see what's on it. And you plug it into your computer and now everything's compromised. Is that really the issue? Like if you've got,
Sure.
Is that really the issue that we're talking about here? Or is
Sure. Especially in an embedded PC environment?
Yeah.
Because USB is so flexible, it can enumerate as a network adapter, a mass storage device, a keyboard, a mouse, and those capabilities, and all of those at once, by the way. So what you do is you do all of those at once and you deliver your payload. If you want to see tools for doing this, go to a company online called Hack5, HAK5, digit 5. They sell bash bunnies. They're really great for that. And if I have physical access to a device, I will get in through the USB if it has not been hardened. And to harden it, there are STIGs that are out there, STIGs, that are used to change about 6,000 attributes, group policies inside of Windows. And one of those is you disable the USB. And you say, but my use case requires, I've got a legacy inductive wand, for instance. That's a big one I see a lot of, that has an 8051 in it and it's using USB. What do I do then? It gets a lot more complex and a lot harder because you've got to leave that turned on, but then you have to have agents that are going to try to prevent anything from happening with that USB. And that's not always possible.
All right.
So it gets really complex.
All right, so let's come back to Shane here for a second. So I know, Shane, you've got, like, we've had this discussion. It came up a little earlier on Singapore, was mentioned, but just in general, like if you're thinking as an early stage company and you want to have kind of like a checklist of some of the major things that you should be thinking about in terms of implementation from the beginning, just kind of run us through just what some of those key items are: secure boot, encryption, et cetera. Like, what are some of these things? We've already talked about SBOM.
Yeah,
just give us a little bit of that.
Yeah, no, exactly. So when it comes down to it, cybersecurity is a massive and really quite scary subject. But okay, let's say you've got your device in front of you, right? And you're thinking, okay, I'm at the implementation stage. Maybe I've got we've done a lot of work with a platform like NXP IMX, which has a lot of these security features built in. But NVIDIA and generally ARM devices will have a lot of this stuff. One of the first things you need to think about is secure boot. I mean, that's where everything starts. So when your device starts up, can you be sure that it's running the software you want it to run and not something that somebody has put on there to get access to whatever your IP is, or get access to whatever your information is stored on there. And most of the manufacturers put that in place, but it usually requires a little bit of understanding to generate the right keys, to program the device correctly, to make sure that only your software can be run. And it also has the implication, and you've got to think about this later on in the process, that every time you update that software, somebody has to have access to the right keys to sign that software. And you've got to manage those keys correctly. You've got to have those keys in a vault somewhere. Who has access to it? And for any keys that you're talking about, the same things might apply. The other thing that your device most likely will have is protected health information or personal identifiable information. Now, you've got to protect that too. So you at least have to encrypt that. one easy way to do it is to say, okay, I'm going to encrypt the entire storage. Okay, that is one way to do it. But have you got a platform that's capable of running that, of actually running all of the other functions that your device is supposed to do, and also encrypting, decrypting bytes as they go to and from the storage? And that can be a load. And if what we've seen is that a platform like the MX is capable of that. You can use hardware acceleration to help that along, but not every platform has that. But you can run through the list. Firewall, obviously, you've got to have that. Users access. excuse me. Users access the device. Have you got the roles right? Have you got the different supervisor role versus user role? What things do they have? Sorry, this list is going to get shorter because there's something in my throat here.
That's right. We can save you, and you can get a drink of water.
We're losing Shane. We're losing Shane.
You're welcome to go ahead and do it. No, that's a good start, Shane. You don't have to keep going. You can take a pause.
There's a lot. There's maybe 5 or 6 more things that you really have to do, but it comes down to protecting the data, protecting the device's integrity, protecting any software that's on that device.
Let me jump in and save you, Shane, for a moment here. And just also ask this broader question for everybody, which is, cybersecurity harmonization. Like, is it harmonized globally? If I'm good in the U.S., does it match the restrictions and expectations in Europe, or the Singapore checklist that you mentioned? Like, I see Chris laughing and shaking his head.
Sadly, no. And in fact, I've got an Excel spreadsheet where I try to connect the dots, and even I don't like it because it's unfortunately they all worldwide have the same goal: securing the medical device. But all of the different standards that are out there all go about it different ways and view it in different ways. It is right now a giant cacophony out there of these approaches. For the most part, it's okay for your country of origin. They're going to kind of give you a bit of a pass, but not much. And there's some major differences. Just in the standards, it can be technical solutions and testing that they want. It can be overall philosophical approaches to how you go. So the level of abstraction is even different between them. One of the things I hope to see happen here in the next 5 years is some real harmonization come about. And that is sorely needed forget international, inside of our own country. Okay. The United States, we've got individual states enacting privacy laws, okay, that are run counter to each other. So how do you keep track of this? So in the United States, we need to harmonize at the federal level for things like privacy, but then we also need to worldwide bring everybody together on this. And so far, the one attempt that was done, I forget the name of the joints. That wasn't the Joint Security Plan. That's a good one. But there was another one that was done that was supposed to harmonize it, and they cut and pasted from everything, and it was very badly done. Terminology wasn't consistent, and it was sad. I applaud the effort, but the execution wasn't that great. So.
Thank you. So I also want to talk, kind of just again, like on the tactical, kind of practical side of things. And I know, Milt, you're representing the man on the ground there, working with those manufacturers. So from a manufacturer perspective, from a startup, right, small little company, not that many people, is this something that, and maybe it's a little bit of a loaded question, but is this something that you can do on your own? Can you get to like the level of security that a customer is expecting on your own by just going to the FDA website and reading the guidelines and maybe some of these other places? Or do you need a consultant on the outside? Like, what kind of capability do people need, I guess, is really what I'm getting at, to be secure enough that when you go into that customer and you say, here's my product, they're not going to laugh you out of the room and say, we're never putting that inside of our infrastructure here. So is that, is it possible, just give us can it be done completely in-house? And or do we really need to be working with outside companies at this stage of the game?
Yeah, I think that's a great question. It's one that I've sort of spent a lot of time focusing on. I'd even add a little more context to it, from the direction of medical device manufacturers. Their day job is they manufacture that medical device. They're very deep in the particular application. They're all about intended use, safety of intended use, improving their process, being competitive. That's where 80-90% of their bandwidth and capacity is focused towards. The 10 to 20% remaining go towards everything else. That can even include things like a safety case for failure of various components within their system. It can be things even that fairly adjacent to their main area of concern. So something like cybersecurity is so overwhelming that there's so many terms, there's history, and they can see not just that the FDA wants them to do it, they can actually see this threat growing in the world, and they know that they need to respond to that. It's kind of like keeping away your nightmares while you pursue your dream of a release device. So it really comes down to what's that balance point, and so I sort of term it as like a cyber MVP, minimal viable product on the cybersecurity. And I would love to say, and specifically bullet point for bullet point, that is, and lay that out, but it depends. Like everything in the regulatory side, it depends on your intended use, it depends on your application, it depends upon your use cases. So for example, if you have an absolute need to use a USB, now you have to embrace all those measures to protect that USB. Conversely, if you're fine not connecting to the internet, then that makes that eliminates that entire attack vector. So depending upon the features that you need, of course, you need protections for that. And there is sort of a concept that I've seen initiated externally, and that I've also initiated with customers of let's keep it simple in the beginning. This is both a combination of sort of road mapping, come up with an MVP and then roadmap the features and ensure that your architecture, your hardware can support this, and that you're not painting yourself into any corners. But do you have to do black key protection right up front? Maybe not. But if a later feature demands that, then you may need at least a hardware that'll support that in the future. So that's the perspective and approach, is what's the minimum set that we need based upon our intended use or use cases. And then you want, frankly, you don't want to go from focusing on, infusion pumps to how do I get good at cybersecurity. You either hire somebody for that, it's a deep enough field, or you go to external consulting. I'd say most of the customers I encounter, they would almost cynically jump to, well, yes, you go to external consulting, and then they're going to, fear mongering, and now I have to spend 50% of my budget over here on cybersecurity. And like anything else, you need to filter for that and find somebody you can trust who's going to give you a small, minimum viable product that with each feature that's tied to a particular risk that you can identify with. And if you do that, then you get that MVP, you get tight implementation, and you're on the right hardware and using the right technology so that you can scale it in the future.
So thank you, Milt. And I guess maybe just related to that really quick, is the talent base out there? Meaning, like, if I'm going to recruit somebody to come join my company as a cybersecurity expert, is this a really competitive field? Is it hard to find people? What's it like out there?
I defer to Chris or others. I haven't hired a lot of people there, so.
So it's, well, you've seen the headlines for IT cybersecurity, which is completely different, by the way, than embedded cybersecurity. Very few overlaps. It's a very minimal Venn diagram between those two disciplines. But there's the shortfalls. I've seen millions of shortfalls in cybersecurity personnel for the IT industry. For embedded, they just don't exist. Okay, literally what I'm doing, and in fact, I'll plug my book. There's the book up there in the bookcase, that Medical Device Cybersecurity. That was the first step we took, me and my co-authors, to help engineers in medical device companies become aware of this. The second thing we've stood up now is a 3-tiered certification training program where you send your engineers to us, and we're going to train them in cybersecurity. Are there still some elite topics where an SME is going to be needed? Sure. Occasionally they're going to come over and say, hey, how can we do this very odd thing? But they don't know the difference between encryption and integrity checking. All right. And when those two can be together, all right, there's common, easy stuff. There's just no training, no awareness of it in engineers. And the first thing we do in the first level course is I show them how to hack. I throw in a bunch of kits that's part of the package. And we do things such as reverse engineering code. Okay. I routinely run into engineers who think once I compile this code, nobody can decompile it. Oh, so wrong. Okay. Oh no, I've programmed this. Nobody can get this out of the device. Oh, please. Okay. I've used external program space. Nobody can read that. No, very easy. $20 cable from FTDI cable, and you can suck out a hex file and then run it through a decompiler. And in another minute, you'll be looking at high quality C code. So the first thing I have to do is show them this is easy. Anybody can do it. What you think are mitigations aren't. Right? If you're doing something like using a universal crypto key for all your devices, I'm going to just extract that immediately out of there. Do using side channel attacks like differential power analysis. You can walk every bit of that key out. So always make all of your authentication keys and encryption keys ephemeral, unique to a device. So there's things like that you can do. So my goal here is within 5 years, I can walk into any MDM and talk to their staff engineers intelligently and about cybersecurity, and they're going to at least know the basics of what they need to do. We're in the development lifecycle to create vulnerabilities, because that's what we're hunting, by the way. We're not hunting threats, we're hunting vulnerabilities. And where are they created? How are they created? What are the tools and techniques we use? That's what you can do that in there in a very systematic way that you can manage and predict time-wise and schedule and run it like you do anything else. I mean, I'm an old guy. I've been in this a long time. I remember when the FDA first started looking at medical devices seriously, and they were using it user experience, and then they wanted to see our code. And we're like, "Where? You don't get to see our code. We're the experts. We know what we're doing." Well, guess what, folks? We've come past that. So now it's cybersecurity, and people are going, "Oh, well, they don't need to do that." Yeah, they do. And in fact, they're currently going. They have always worked under the auspices of safety, because they're chartered with enforcing safety and efficacy of medical devices. They have now gone to Congress and they are wanting an explicit mandate for cybersecurity. So they can come back and do all the SBOMs and mandate all this stuff, and it's very clear cut, and they'll get it.
Yeah, let me get to one of the questions that came in from YouTube. So this is from someone who's saying, "Hey, as a clinical engineer, what are some of the cybersecurity measures we should be taking while procuring medical devices?" So what should those, now they're saying as a clinical engineer, but from the clinical side, what should they be thinking about when it comes to looking at these medical devices as they're evaluating them? What should they be looking at? What kind of cybersecurity questions should they either be asking? Forget about measures to take, might be a little longer than we have time to talk about today, but just what are some of the key things they should, if you were sitting down, if Mayo sat down with you and said, "Shane, Chris, Milton, what should we be thinking about? What are the big things that they should, what are the questions that the site should be asking the provider of the MDM?"
Well, I'll jump on this if you want.
Sure.
I know one of the things I mentioned before, the cybersecurity labeling, that hasn't materialized yet, but it's coming. So what do we do today? Well, the two things you can ask pre-procurement that really give you an insight into their maturity, and I know HDOs are doing this already, is they ask, "Okay, we're looking at your Acme ventilator here, and we're thinking about buying this, and you're competing with this, and we're going to buy 500 of them." And one of the questions should be, "I want to see your MDS2 spreadsheet, and I want to see your software bill of materials." If the manufacturer can immediately give you that, if they go, "Give us a week, we're going to make one up for you," you're already off the consideration list. You're no longer a candidate. They're using that as a sign of maturity of your development process, that you have these and they're ready to go. If you say, "Yeah, here's the URL for them, go have at them." The MDS2 is about 340 questions, if I recall correctly, in a spreadsheet about how you develop the product. And so they want to see that. So that's a great place to start. Also, Mayo, speaking of Mayo again, they on their site it's kind of buried. It's a few levels down, but they do have their contract language for you want to sell to them. That is really important. And I would suggest you go take a look at it as to what your expectations are after the sales for that medical device manufacturer and how they're going to support you. Or you can wait about 2 months, and a working group I'm in at the Health Sector Coordinating Council will be releasing default contract language for cybersecurity for hospitals to use when purchasing products. And you can just put these terms right into your contracts. So it involves things like liability, ongoing support, awareness, updates, covers everything. And it says, this is the expectation when we buy your product that we're going to see. So that's coming out of the HSCC here in a couple of months. Definitely worth incorporating.
Great. Thank you for that. So we've only got 4 minutes left in the public broadcast here. And I want to make sure we kind of give some good wrap up thoughts for the public broadcast, and then we'll stay on for 30 more minutes of private Q&A with our companies. But starting off, I'm just going to go one by one through the panelists, and I'd love you guys to reflecting again on the conversation. What are some of the key things that you want people to take away? If they're an innovator, if they're out there thinking about this issue, what are some key either suggestions like, oh, there's a resource you can go find online, whatever it might be, any closing thoughts you want to share with people, and then also tell us how to find you. Do we find you on LinkedIn and so on? So I'm going to start off with you, Shane.
Sure. So, as I said at the start, cybersecurity is obviously a big, scary area, and my main advice would be to try and engage with it early. My main advice would be to say, well, what are the minimum types of things we need to do here? If you're looking at a device, maybe you can simplify things, but basically, where is the critical information that I want to protect? How do I protect it? How do I make sure that this device isn't going to be used as some kind of entry point later on into a system? Those are the key things you need to think about. And if when you're choosing your platform, when you're choosing what kind of computer or embedded system that you're using here, just make sure that it is capable of doing what you need it to do later on. And I think that's what you need to think about straight away. Obviously, there's so many worries out there about how you're going to do the regulatory portion, how you're going to do your quality management system. You're better off at the start trying to fold it in there. And for myself, you can find me on LinkedIn or on the ICS website as well.
Thank you, Shane. Milton.
Yeah, in terms of key things to take away, so yeah, cybersecurity is a sort of a vast topic. It can be scary if it's not your main focus and you don't have a lot of spare time on your hands because you're running a business. But I temper that with, the first tier of cybersecurity solutions are fairly well established out there. It's part of the guidance, and it's part of the practice of anybody who is, in the space. For first tier solutions, there's not a lot of invention. So, it's not R&D. It's simply applying tools based upon your intended use, your use cases, and at the end, you're going to do some you're going to do some external penetration testing against your device anyway. So that's going to come back with a list of things to fix, and that's so. I end that all with, basically it's surmountable. This is something where you don't want to bury your head early on. You really want to have your head up, anticipate it, look for the right people to help you with the solution. It's going to impact your hardware architecture. It's definitely going to impact your software architecture. But then, that cost is anchored in the beginning of your program, and then otherwise execution should go fairly smoothly. There will be stuff found in your penetration testing that you'll want to deal with, but this is a heads up approach, as opposed to what we do see oftentimes is people sort of minimalizing it in the beginning, getting to the midpoint or towards the end, and then trying to throw things on that are very disruptive to the product.
Thanks, Milton. And Chris.
What they said. Get in early. I always tell clients coming in, Well, where are you in your development life cycle? Oh, we're just starting. Oh, that's great. We're going to be best friends. Or they go, we want to ship next Thursday. I go, you're going to hate me. You are really going to hate me. And that's the truth. This is an easy thing to do. It is an emergent property. But if you leave it to the end, you will not be able to do it. It will be painful. It will be expensive. Don't do that, okay? Get somebody like us involved. Get your folks trained. Whatever, they need to start from day one of the project, because I mentioned there's 3 places in the development life cycle you create vulnerabilities. One of them is in design, okay? I'm looking at this and saying, I didn't encrypt the PHI. Okay, I didn't secure my keys properly. I didn't authenticate that user. Those are all design issues. Implementation issues are things like I didn't check the buffer length. Okay, I'm using an unsafe intrinsic value that's susceptible to side channel attacks. Those are implementation. And the third place is in the use of third-party software components, libraries, frameworks, operating systems, communication stacks. But the design one starts off in a formal decomposition of your system and lets you understand, in light of your use cases, where your risks are and where you should put your time and money. It is how we base everything. We don't say we're going to fix all vulnerabilities. We're going to fix the ones that have severe outcomes and are exploitable. That's how you look at it. So it's very much exactly what Shane and Milton were saying. Get in early and it goes a whole lot easier.
And Chris, where can we find you?
Oh, I'm everywhere. I'm also on LinkedIn. I'm at chris.gates@valentium.com, or just go to valentium.com, and I'm on the page as well. And in fact, I have blogs on those pages. So, but yeah, I've got way too many means of communication, actually.
All right, great. Well, listen, guys, I want to thank the 3 of you. Great panel, great discussion. I mean, we got into a variety of topics and a lot of detail, and even then we just scratched the surface, right? So a lot more to talk about in the subject, but really appreciate all of your time. I hope the 3 of you enjoyed the conversation a little bit. I know the pre-discussions were fun, so hopefully you guys enjoyed this discussion as well. So thank you all for being here. And for those of you out in the audience, again on YouTube, that's going to conclude our first hour here on cybersecurity. You can look in the if you reload the video later on YouTube, we'll have some contact information for the panelists. And for those of you who've been joining us on our webinar series, we've got more to come. So please keep tuning in to medtechinnovator.org/live. for upcoming webinars. We've got some really great ones coming up on the regulatory side with FDA and with others. And on September 29th, MedTech Innovator is going to be having its finals competition as part of the MedTech conference. So we'll want you to tune in for that. If you come again to medtechinnovator.org, you'll see a big banner at the top soon that tells you all of those details, but you'll have a chance to see the companies that are competing in our finals. Very exciting, as well as our execution award, our value competition, best video competition. We have videos up right now. If you have an hour or even less, I encourage you to go to our website, go under the nav bar under our US program, and you'll see a link to the best video competition. And you can just sit back and watch 1-minute videos from every one of our companies that almost look like commercials. You know, they're telling you about the product, the team behind it, why they're doing what they're doing, the patient impact, really impactful, moving videos. I highly encourage you to watch those. And if you like them, go onto YouTube and click the like button, because there's a prize right now for the best videos. And you can help contribute to that by liking those videos. So that's it for today on our YouTube broadcast. For our cohort, please stick around. Our panelists, please stick around. And for everyone who's just watching on YouTube, hope you guys all have a great day. Thank you.